Welcome, my love. I am so glad that you are here for the Feel in Control of Your Bladder training. And this training is for you if you have been dealing with bladder urgency, leaking, or that constant feeling like you need to know where the nearest bathroom is, and you're tired and over being told just to do more kegels. So today we're going to look at why your bladder control is not always about squeezing harder and what your symptoms may actually be trying to show you. By the end of this training, I want you to have a totally different way of looking at your bladder symptoms. Not from a place of shame, not from this attitude of my body is broken, I don't know what's happening, but more so from curiosity. You will learn why your symptoms may not be random and why Kegels may not be the whole solution, and what patterns you need to start noticing so that you can stop guessing. I'm Alex. I am a pelvic floor coach and a doctor of physical therapy. I've spent 12 years in healthcare, with the last 6 years specializing in pelvic floor physical therapy. And at this point, I have literally helped thousands of women navigate symptoms like leaking, urgency, pelvic pressure, pain. And on my fun side, or human side, I have two adorable dogs, and I spend most of my days literally talking about pee, sex, poop, pelvic floors. So around here, TMI never means too much information. Instead, TMI to me means tell me immediately. So this work, though, to be honest, it's also personal for me too, because for years I struggled with leaking during workouts, and I totally thought it was normal, by the way. I just thought we just didn't talk about it. And I also dealt with significant pain with intercourse. And at the time, not kidding, I did not even really know what the pelvic floor was or that even pelvic floor support existed. And the advice at the time that I was given by my doctor, that was back then, you're no longer my doctor, thank God, was, well, maybe you should just start using muscle relaxers and just have a glass of wine. What? Literally, that was that. And looking back, first of all, I'm still salty about that. But I also needed actual education. I needed somebody to explain what my body was doing, not just give me a very ineffective way to tolerate it. So that is what I do now, where I try to be now, is the person who explains things clearly, calmly, and with no shame, and give you tips that actually give you results. So before we go any further, I want to share this because this is the kind of pelvic floor support I believe women deserve. So not random exercises, not confusing advice, not this like, well, just do more Kegels and let's hope that it works. But this client in particular shared that our work together felt educational, supportive, and practical. And that matters because pelvic floor support should help you understand your body and not leave you feeling more confused. So this is the goal of this training too, to help your symptoms feel less random, less shamey, and more understandable so that you can start seeing what your body might actually be responding to. And a quick note before we dive in, this training is educational. It's not medical advice or a diagnosis or a replacement for individualized care. If symptoms are new, painful, worsening, or concerning, please check in with a qualified healthcare provider. I always get through this quickly just because, yes. So a lot of bladder symptoms start out as small annoyances. So you have a little leak here, a sudden urge there. You always do a quick bathroom trip before leaving. You want to be on the safe side. And because you can still function, it is easily brushed off because you adjust and you plan ahead. You avoid certain movements when you're working out. You tell yourself it's probably common or that you just need to do a better job about doing Kegels. And over time, these little adjustments can actually start taking up more space in your life than you realize. So as we go through this training, I want you to listen for the patterns, not just the symptoms, but the actual habits, maybe the tension or the daily responses that may be keeping this cycle going. So when symptoms keep showing up, most women try to make sense of them with the information that they have. So they think to themselves, like, I have a weak bladder. This is probably normal after kids. Maybe this is just what happens with age. All of these I hear over and over again. And because Kegels are usually the only thing that women are told about the pelvic floor, it makes sense that the next thought is like, well, I probably just need to do more. But this is where so many women will get stuck. Not because they're ignoring their body, not because they're not trying, but because the story that they have been given is very incomplete. And if every single symptom gets labeled as weakness, then every solution becomes more squeezing. And for a lot of women, that is not the full picture. Bladder symptoms like leaking, urgency, feeling like your bladder is running the show are common. But common does not mean normal. I stress this literally daily because it does not mean that this is just how your body is now. It doesn't mean that you need to keep planning your life around bathrooms, that you need to avoid workouts or hope that it magically goes away. These symptoms are often clues, and today we're going to look at what they might be pointing to. The shift that I want you to understand today is this. Bladder control is not always a strength problem. Sometimes it's more of a pattern problem. That means that the answer is not always more effort, more squeezing, more kegels, more, because sometimes the very first step is understanding what your body has been practicing all day long. And hear me here, kegels are not bad. They can actually be really helpful for the right person at the right time. But they're not the whole story. So if your body is already gripping, bruising, holding tension, responding to pressure that is really uncoordinated, more squeezing is not actually going to solve the problem. It is going to add even more tension to a system that already feels overloaded. And this is why random advice can feel really frustrating, because one woman might actually need strength, but another, it's more about less gripping or changing bladder habits. Another may need to work on coordination. But when everyone gets the same advice, which is like, just do Kegels, a lot of women will end up feeling like they failed, when really the advice was incomplete and inappropriate. Today, we're going to look at the 3 clues that your bladder symptoms may be connected to, the patterns that your body has been practicing throughout the day. So the first clue is being just in case. The second is holding tension without realizing it. And the third is treating every symptom like weakness, which you know is my particular pet peeve. And these might seem simple, but they can actually really explain a lot, because once you start seeing those patterns, the symptoms will begin to feel less random, and you can finally have a clearer path to go through and a place to begin your healing. So the first clue is being just in case. So this looks like literally what it sounds like, right? But going before leaving the house, before your bed, before your workout, before you go for coffee, before you have a meeting, before you have a car ride, before you actually even feel the real urge. And it does feel responsible. It feels safe. It feels like you're preventing a possible problem. But over time, this habit can sometimes reinforce the exact urgency pattern that you have been trying to avoid. Your bladder learns from repetition. So if every small signal turns into a bathroom trip or this urgency emergency, your bladder starts sending signals sooner and sooner with even more urgency. Over time, your body gets used to going at this very first little tiny feeling of like, ooh, I could go right now. And so you go then instead of waiting to feel fuller. Right? So this is why this just in case peeing, it can keep that urgency loop going, even though it really does feel helpful in the moment. When this pattern continues, it can start to feel like your bladder is unpredictable. You start planning your errands around bathrooms, you feel anxious in a car, you pee before leaving, and then, by the way, as you leave, just a few minutes after, even 10 minutes, you still feel like you need to go again. So the hardest part is that it can slowly chip away at the trust that you have in your body. Tiny shift here, okay? I'm going to include tiny shifts because I want you to get better. I want you to see that tiny little shifts or tiny little actions can create amazing results in your life. So your tiny shift here is not to force yourself to hold it for hours or ignore your body. Please do not do that. But the shift is to simply pause and ask yourself, do I actually need to pee, or am I just going to be on the safe side? That one question helps you start separating a true body signal from an automatic habit. And this is a huge first step because you're not trying to control your bladder through force. Now you are learning how to listen to it with much more clarity. The second clue is holding tension without realizing. And this is a sneaky one, by the way, because it usually doesn't necessarily feel like tension at first. It might feel to you like normal posture, focus, control, or just the way that you carry yourself throughout the day. But if your body spends a lot of the time slightly braced or slightly on, it may have a harder time knowing when to fully soften or when it needs to respond, or even more importantly, when it needs to coordinate. So, before we even talk about relaxing the pelvic floor, I want you to start noticing whether your body, right, the areas all around the pelvic floor essentially, are living in a low level holding pattern. It's not dramatic, it's not obvious, it's literally quietly on. And this can show up in really small everyday ways. So, your shoulders creep up. Your hands will curl into a soft fist. Your stomach is just pulling in. Your glutes grip. Your jaw tightens. The breath gets held. And most of the time, you are not doing it on purpose. It just literally becomes the way that your body moves through the day. And this matters because a body that can never fully settle, it then becomes more reactive. So your bladder does not exist in isolation when your whole system is already on alert, tense, rushed, braced, stressed, like, ugh. Those bladder signals can feel louder and more urgent. Because you see, the bladder is part of a connected system. And again, that system is always responding to what is happening around it. And when this pattern continues, it may keep you trying strengthen the body, like you keep on trying strengthen the body, but your body is already working in overtime. So it's just creating more tension and more issues and keeps the symptom going. And that's when things get really frustrating because the more you do, the more you try harder, the more you squeeze, your body's default is already tension. So you're adding more tension, and that doesn't create the control that you are really looking for. So, how do you fix that? Your tiny shift here is to notice, where do you hold your stress? Become what I call the gentle observer. So you're not trying to fix it or force yourself to relax. You are simply noticing where your body is holding stress without judging it. So you can do a full-on body scan, going up from the jaw, down to the shoulders, hands, belly, glutes, pelvic floor, and checking on your breath. And then, if you notice an area that is more on the tense side, see, can you soften it by 5%? You're not collapsing, you're not releasing everything. This is not like a dramatic thing, but you literally soften just by 5%. Can you melt 5% more? That small shift can start teaching your body that it does not need to move through the whole day brace. The third clue is assuming that every symptom means weakness. And this is probably the biggest reason women will jump straight into Kegels. But leakage does not always mean that there is weakness. And urgency doesn't always mean that there is weakness. Pressure doesn't mean that either. So sometimes the body is struggling with timing, tension, habits, pressure, coordination. So those symptoms might be connected to what I just said, right? The timing, tension, breath holding, bathroom habits, stress patterns. And this is why the pelvic floor symptoms can feel really confusing because you might be active and literally physically strong, but you're still leaking. You might be doing Kegels all day, every day, but you still feel urgency. And fun fact here, by the way, I was reading research recently, and it is up to 80% of us women that when we think we're doing a Kegel or a pelvic floor contraction, we're not actually doing it properly, right? So think about it. How do you do Kegels? And that is something that's really important because it's something we really do get told, like, oh, you should be doing Kegels, but nobody ever teaches you how to do it. And then if they do, nobody qualified, emphasis on that, qualified, checks if you're doing it correctly. So you might be doing stretching, you might be feeling tight. And again, strength is only one piece of the puzzle. And that's even if you're doing it correctly. So when every symptom gets treated like weakness, you may need to keep doing more without understanding what your body actually needs. So this is a cycle that so many of us get stuck in. So we do more exercises, more tips, more Kegels, more strengthening, more Googling, and you're not gaining any clarity. And clarity is the thing that changes how you approach the whole problem. So your tiny shift here is to ask, what have I been assuming about my bladder? Is it that you are weak? Is it that this is normal? Maybe you think like, oh, I always need more kegels, or this is just how you are right now. Those thoughts matter because they shape what you try next. And if you assume, again, that every symptom means weakness, you will probably keep reaching for more squeezing. You're just going to keep on thinking that this is like a kegel thing. And if your symptoms, though, realistically, if they are really connected to tension, that pressure, habits, coordination, your body may need a different starting point. So this question here helps you pause before jumping into the same old solution that will give you the exact same results. Here's a simple assignment for you. For the next 3 days, I want you to become that gentle observer. So notice these 5 things. When do you just pee in case? When does urgency show up? When do you clench, grip, brace? When do your symptoms happen? And what are you assuming about your body? You don't need to change everything immediately, but you do need to start gathering clues, start noticing patterns, going after the mindset here that you have developed over years. So this check-in helps you move from my bladder is random to, oh, okay, my body actually has patterns. It has habits. There's been some consistency to the things that I have been doing. And that's where we need to do the little bit of a tweak, because that is the big deal. When something feels random, you feel powerless. And that's a horrible feeling to feel over your body. But when you begin to see the patterns and the habits, you have a place to begin. Now, awareness, no, I'm going to be honest with you, it's not the whole solution, but it is the first shift and the very first step that is required for your journey to get better. And the bigger truth is that you don't need to obsess over your bladder. You need to understand what it is that it is responding to. So that is where most women get stuck. They notice the symptoms, but they don't necessarily know what it means. They know that something is off, but they don't necessarily know what to do next besides what they have done, which is the Kegeling, the Googling, TikTok, more waiting. So this training, I hope, has helped you see the clues. But the next step is understanding the system. So again, your bladder, your pelvic floor, your breath, pressure, habits, coordination, everything is connected. And the approach that I take in my practice is a whole body wellness approach. This is where the deeper education matters, because once you understand that these are essentially like little pieces coming together, like a Lego almost, your symptoms stop feeling like a mystery. And it gives you that sense of empowerment over your body. And that's what this is all about, is you not feeling helpless and powerless or depending on constantly on another provider, on another person to make yourself feel better, relying on another video to just basically remind you like, oh yeah, this is an issue and I'm just going to brush it off, or I'm going to keep on doing what I have been doing, but it kind of expect a little bit of a different result, but also I'm just going to get the same result. This is exactly why I created Pelvic Floor Basics. So it is a masterclass designed to help you understand what your symptoms may be responding to, so that you can stop guessing and start feeling more in control of your body again. And this is not about overwhelming you with anatomy. I know that it might seem scary at first, and really I break down the anatomy is included, but I break it down into human, like relatable words. And it's really about giving you the foundational understanding that most of us were never taught, literally never taught. Most of people in my class, most of the people who were getting my DPT, the DPTs next to me, were women. And it was brushed off as something that's like, oh, nobody likes to talk about it. So it's just like not. And, any videos that were there, everybody would just be like, oh God, what's happening? The way that it was handled was odd and uninspiring, to say the least. So this foundational knowledge, I want to give it to you. I want you to have something that will support you in your life for the rest of your life as a woman. This is something that you were born with and that will be there as you age. And when you ignore things, they don't just randomly get better. We go into the deeper foundation behind your symptoms, but in such a way that it actually feels useful for your life. So you will learn why leaking, urgency, pressure, or tension don't automatically mean that you are weak or broken. So you'll understand why just doing more kegels has not been enough and what the bladder and pelvic floor may be actually responding to instead. So we'll be connecting the dots between breath and pressure habits so that you can stop feeling like your body is confusing or unpredictable. The goal really here is to leave you feeling more hopeful, more informed, and more in control of your next step. Because once you understand what your body is trying to show you, you can finally start working with it instead of trying to fight against it. So when you join Pelvic Floor Basics, you will get 3 pieces. So first, you get the Pelvic Floor Basics Masterclass, which is the core training that we just talked about. You also get the pelvic floor self-assessment, and that's a guided questionnaire to help you start noticing whether your symptoms seem more connected to tension or pressure management, or is there a coordination issue. And then you get the coordinated pelvic breath audio practice, and that's a short practice to help you how your breath and your pelvic floor are meant to be meant to work together. Because understanding is one thing, but feeling it in your body is where the light bulb really starts to click. And that, by the way, that audio practice is the very first thing, the very first assignment / practice that I always do with both my patients and my clients. It's the foundation, the basics that if you don't get that, we're not moving forward. We're going to be working at this breath practice until your body and your mind sync up. And so pelvic floor basics is for you if you pee just in case, if you're tired feeling like you always need to know where the bathroom is, if you leak, especially when you laugh, cough, sneeze, if you feel urgency, frequency, pelvic pressure, tension, pain, and you just keep wondering, why is this happening? And it's especially for you if you have tried Kegels and you still feel like something is missing. So this is for the woman who knows that something feels off, but they really don't want another random tip, and they're ready to understand what my body is actually doing so that I can start feeling more clear and hopeful and in control again. And I wanted to share this because it just shows why the foundation matters. This client of mine was sharing that we didn't just jump into random exercises, but we rather talked through what was contributing to her urinary symptoms, and that itself helped her move through the leaking with more understanding and support. This is the piece that so many women are missing. When you don't understand what your symptoms are connected to, it's really easy to just keep trying things that particularly are not matching what your body actually needs. So that is the heart of the pelvic floor basics, understanding the system that's behind your symptoms so that you can stop guessing and you can start seeing what actually needs to shift. Pelvic Floor Basics was created to give you that foundation that most of us were never taught. Because if you have been leaking, peeing just in case, or feeling urgency, that pressure, tension, maybe pain, and wondering why Kegels have not changed everything, the problem is not that you have not tried hard enough. It might actually have been that you have been trying random things without understanding the system behind your symptoms. So this is what this masterclass helps you start to understand. And the total value of everything is $495, but you can get this instant access today for $39. And honestly, I wanted to make this accessible because this is the kind of education that so many women should have been given years ago. So for less than what many of us will spend on a workout class or a dinner or another product that we hope will magically help, you can finally get the actual foundation that helps your symptoms make sense. So you should not have to keep guessing, and you should not have to keep treating your body like it's broken when it may just be asking for a different kind of understanding. So from here, there are 2 paths. The first path is to keep collecting random tips. So another Kegel cue, another Kegel video, you know what time it is, another stretch, another video, maybe this will work moment, and truly truly, 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 no shame if that's what you have been doing. Most of us do this because we're trying to help ourselves. But the hard part is that those random tips will keep you stuck in the same loop. So you may keep peeing just in case, avoiding certain workouts, leaking when you laugh or you jump, and wondering why your body still feels tense even though you're trying. But the second path is getting the foundation you need to stop feeling confused by the symptoms and start feeling more in control of your bladder again. Not by doing endless kegels, by finally understanding what your body has been trying to show you and what needs to shift next. So, this does not mean, by the way, that this has to be your new normal, because it doesn't. You don't have to keep on planning your day around bathrooms or avoid workouts that you used to love. Cross your legs every time when you laugh or sneeze or wondering why Kegels haven't worked. And you should not have to feel disconnected from your own body just because no one ever taught you how your pelvic floor actually works. Your symptoms are not your body failing you. They are your body trying to communicate. And when you understand the message, you can finally start moving forward towards feeling more connected to your body, towards having more confidence in your next step, and feeling that control of your bladder again. So if this video training helped you realize your symptoms may not actually be that random, I would love to invite you into pelvic floor basics. So this is your next step if you are ready to stop guessing and start understanding what your bladder and pelvic floor symptoms may be responding to, so that you can actually begin changing the patterns behind them. So I want you to leave with this. You're not broken, you are not behind, and your bladder is not the boss of you. Your body is giving you clues, and now you know where to start paying attention. So when you are ready, use the link near this video or in your email to join Pelvic Floor Basics and start with the foundation. Thank you for joining me today, and I hope to hear from you soon.